The history of nursing informatics in international and Philippine setting. The computer is the most powerful technological tool to transform the nursing profession prior to the new century. It has transformed the nursing paper-based records to computer-based records. The computer and the internet have become essential to the modern day, which functions a lot. Computer is an all-encompassing term referring to information technology or IT, computer systems, and when they are used in nursing information systems, nursing applications, and or nursing informatics.
Nursing informatics has emerged as new term encompassing these technologies, enabling nurses to manage healthcare and patient care more efficiently and effectively, and at the same time make nurses more accountable. Computers in nursing care are used to manage information in patient care, monitor the quality of care, and evaluate the outcomes of care.
International setting.
Now let's go on to the timeline of nursing informatics. Computers were developed in the late 1930s to early 1940s, but their use in healthcare industry occurred in 1950s and 1960s. Prior in 1960s, computers were initially used in healthcare facilities for basic office administrative and financial accounting functions. These early computers used punch cards to store data and card readers to read computers programs, sort, and prepare data for processing. So by the mid-1960s, clinical practice presented nurses with new opportunities for computer use. Increasingly complex patient care requirements and the proliferation of intensive care units required that nurses become super users of computer technology as nurses monitored patient status via cardiac monitors and instituted treatment regimens through ventilators and other computerized devices. Year 1970s. During the late 1960s to the 1970s, hospitals began developing computer-based information systems which initially focused on physician order entry and results, reporting, pharmacy, laboratory and radiology reports, information for financial and managerial purposes, and physiologic monitoring systems in the ICU. And also, a few systems started to include care planning, decision support, and interdisciplinary problem lists. During the 1960s and 1970s, interest in computers and nursing began to emerge in public and home health services and also in education. Next is year 1980s. In 1980s, the field of nursing informatics exploded and became visible in the healthcare industry and nursing. During this period, many mainframe healthcare information systems emerged. These systems documented several aspects of the patient record, namely provider order entry and results, reporting, the cardiac reporting, vital signs, and other systems. Documented narrative nursing notes using words processing software packages. And also in the year 1980s, the microcomputer or personal computer PC emerged.
In the year 1990s, large integrated healthcare delivery systems evolved, further creating the need for information across healthcare facilities within these large systems to standardize process, control cost, and assure quality of care. Nursing informatics was approved in 1992 by INA as a new nursing specialty. Internet is widely used and health information and knowledge databases to integrated into bedside systems. In the year 2000, a change occurred in the new millennium as more and more healthcare information became digitalized and newer technologies emerged. And in the late 2000, as hospitals became paperless, they began employing new nurses who had never chanted on paper, and technological developments that influenced healthcare and nursing included data capture and data sharing technological tools. In the year 2010, a historical analysis of the impact of the nursing minimum dataset demonstrated that continued consensus and effort was needed to bring to fruition the vision and implementation of minimum nursing data into clinical practice. The billions of dollars invested are intended to move the health industry forward toward complete digitalization of healthcare information.
Nursing informatics in international settings faces several challenges, including cultural differences, language barriers, infrastructure and resource limitations, regulatory differences, and data standardization issues.
Addressing these challenges will require collaboration among healthcare providers, IT professionals, and policymakers to ensure the effective development and implementation of nursing informatics solutions.
Philippine setting. The Philippine Medical Informatics Society, or PMIS, and its founders had a strong influence in the development of health informatics in the Philippines. The PMIA was officially registered under the Securities and Exchange Commission in 1996 by its board composed of 11 physicians. The organization was headed by Dr. Alvin Marsalo.
Timeline of nursing informatics in the Philippines. In 1998, several faculty members of the University of the Philippines began formal education and training.
In 1999, a study group was formed headed by the National Institute of Health of University of the Philippines, Manila. This group identified the international standards for health information and their adaptability in the Philippines.
In 2003, a Master of Science in Health Informatics was proposed to be offered by UP Manila College of Medicine and the College of Arts and Science, and was later approved to be offered starting academic year of 2005 to 2006.
In 2008, nursing informatics course in the undergraduate curriculums was defined by the Commission on Higher Education Memorandum Order 5 Series of 2008. And it was later revised and included as Health Informatics course in CHED Memorandum Order 14 Series of 2009.
In 2009, they began recruiting other nursing informatics specialists and practitioners to organize a group which later became as the Philippine Nursing Informatics Association.
Like many other disciplines, nursing informatics faced many challenges. First is the context of the curriculum was adopted from international materials, which does not match the local needs. They are absent with the scarcity of local nursing informatics experts, renationalization of hospital, financial capacities, and there are problems in implementing policies.